Welcome to Navigating H.O.P.E, your compass to health empowerment. I'm Dr. Jamie H.O.P.E, steering you through healthcare, overcoming overwhelm, personal goals, and emergencies. We'll navigate the healthcare maze with actionable insights and real-world advice, unlocking the secrets to a healthier, more vibrant life. Join us to take control of your well-being and make informed decisions for your health and your future. Stay with us as we unravel the mysteries of medicine, wellness, and life's unforeseen challenges, helping you bypass the ER with a dose of knowledge. Stay tuned till the end of the episode with a recap of your actionable insights and a free gift. Let's chart a course to your well-being together. All right, I am so excited to be back again today. I have Dr. Patrick K. Davis. That'll help you find him on Instagram. He is a renowned facial, plastic, and reconstructive surgeon delivering highly personalized treatment experience in Beverly Hills, California. And I love that highly personalized. We're going to get to that. He is board certified in otolaryngology, head and neck surgery. And for those of you non-doctors playing along, otolaryngology is ENT. Dr. Davis's extensive training and empathetic ear allow him to tailor each patient's treatments for uniquely exquisite results. Dr. Davis trained in a highly selective Beverly Hills facial plastics fellowship, and I'm very confident that'd be a highly selective group. Prior to the surgery residency at Emory University in Atlanta, Georgia, he also attended Indiana University School of Medicine, where he received his Doctor of Medicine degree. He then served as the founder and director of the first student-led, no-cost medical clinic in Northern Indiana. His work earned him the prestigious American Medical Association Leadership in Medicine Award. And if that weren't enough, while completing his undergraduate studies at Miami University of Ohio, Dr. Davis was a quarterback for their Division I football team. Before attending medical school, he spent 3 years serving as a Peace Corps volunteer in the Dominican Republic, where he contributed to multiple medical missions in Santiago and later went to work with Haiti for the survivors of the 2010 earthquake. He has a number of peer-reviewed publications in surgical journals throughout the past decade, including the esteemed publication Journal of American College of Surgery, which I have actually heard of. Honestly, we were joking right before we started. You don't even sound real. You're a football player.
Oh, thank you.
But what gets me most excited is the empathetic, the customized approach. Like, that's what people are looking for in this industry, because it can be very intimidating.
Absolutely. That was a wonderful thank you so much for that introduction. The history of who I am led me to this particular point to be in Beverly Hills. I grew up in the Midwest, so I'm an Indiana boy.
Yes.
But that helps me. Those experiences help me as a physician be empathetic, and certainly as a surgeon to, as you know, Jimmy, you're a physician as well.
Oh.
Listening to our patients is so important. You can oftentimes, yes, we have all kinds of medical training and medical knowledge, but the patient will oftentimes, sometimes not explicitly, will give you the diagnosis.
Yes.
And in my industry, especially in facial plastic surgery, the diagnosis isn't so much as an actual disease, but it's more of what patients are feeling on the inside, what are their desires. And so I do ask very pointed questions that help to get me at a more customizable approach, because every single face, for example, is different. We have different facial structures, different ethnicities, and there's different ways that society looks at a face, and which for me is fascinating. And the people that I meet are fascinating. And 9 times out of 10, the people that come into my office have a very specific need, very specific reason, and we treat it, and they go about their lives. And some of them, from a superficial stance, from like the skin standpoint, they feel transformed. And there's some people that, the ones I enjoy the most, is there's more of an inner transformation as well. And just like this feeling good about themselves, especially we're in a media-driven society, and going out, we have lawyers and TV personalities and actors and actresses that can go about and do their jobs with just a little bit more confidence.
Yeah, that's so interesting that you said that. So we're going to jump into that, is that little change that they can make and they feel different on the inside. And I've always said, if we women or anyone who are concerned about their appearance took all that energy that they're focusing on their under eye bags and all the amount of like social
Mhm.
capital and emotional energy, and you fix that, and they're like, oh, fantastic, now I can do other good things, rather than just saying, you're so superficial, how dare you want to change your face, why do you care what you look like? I love that. What are your thoughts when you hear patients about this and that transformation?
Well, that's a couple of things you mentioned. So specifically, like the eye bags is a good example. Somebody who comes in and
Mhm.
they're like, "Look, people say I'm tired,
Oh,
but I'm not
public
tired."
service announcement. Stop telling people they look tired. It's
Yeah,
so
and that's so and so
yes,
obviously you can be 30 years old, you can be 40, you can be 80
yes.
years old, and you have this inner energy. We all have this that I don't want to be told that I look tired, and it's just the way, unfortunately, the aging process works. So there's
Yes.
ways that we can take care of those bags, especially surgically. That's the best way to do it.
Mhm.
And people get it done, and they're like, "Great, that's taken care of. I can go about my life." And I now there's a little bit more of a match between how I feel and how I appear. And most times it's just like this kind of tired kind of feeling. And then about like what there's sometimes people are judged by doing this kind of work. We
Oh
have
yeah.
a neon sign in our office. It's inspired by RuPaul that says we are all born naked and the rest is drag. So we are naked in ourselves. Like we have a soul. We are who we are. And the things that we wear throughout the day in our life is just drag. The personalities that we put on, the haircut we make, the clothing that we wear. And all we're doing is from a more cosmetic standpoint or aesthetic standpoint, making people put on their drag. And everybody has a right to do this kind of stuff. What gets me is just because someone has had something done, they don't deserve any kind of judgment for that. Just if you don't want to necessarily do anything, there's no judgment for that either. And
Right.
so I always we're born naked, and the rest is just how we want to live this life. And as long as we're not hurting people, and my pledge to my patients is just do it right and have it done safely. And then
Yes.
none of this stuff really becomes an issue.
Nice. I love what you said. So how we feel on the inside matches how we look on the outside. That's so
Yes.
profound. We're going to touch on, you also said safe. We have so many exciting things to dive in here for.
Yeah.
So you are aware of the CDC warnings and all of the media coverage right now for this counterfeit Botox. So first, just
Yeah.
background for people. What is Botox? What does it do? And then let's dive into this counterfeit and all the dangers of that.
Yeah. So this is actually something that really unites you and I, you as an emergency physician and me as
Yeah.
a surgeon, is so Botox is a what's called a neuromodulator. So it works to turn off certain nerves and that control muscles. Historically, it's been, we'll talk about this, but botulism is a disease that can happen from honey that's left out in the open, and then you can get basically your body can become flaccid. But what we found is that, especially with migraines and now aesthetically for the past 20 years, that if you turn off certain muscles, you can have a favorable aesthetic result. And also, for example, migraines, you can help cure migraines because sometimes that muscle tension can build up. So it's very safe if done in the proper hands with people that have been trained.
Yes.
What we've seen with the CDC of recent, so in November, I believe it was the first case across this country, is that there's a couple things going on. There is this unverified Botox. So
Mm.
Botox is like Kleenex in the industry. There's other types of Botox that are FDA approved. Jeuveau is another one, Dysport, Daxxify. These are approved, FDA cleared. But the CDC is looking into those at particular med spas that have been potentially injecting unverified, so not FDA approved Botox, and people are having what we just talked about, some of the botulism symptoms, more
Yeah.
systemic or bodily systems. And then there's also investigating those who are not or who are under licensed or not licensed to actually inject these things.
Right. A couple things to unpack there. So Botox is a brand. There are other brands. You mentioned Dysport, Xeomin. So those are
Yeah.
not the danger. It's okay to have other brands. They're all essentially the same thing, right? The
Yes.
botulinum
Yes.
toxin, right? So they all do that. It's the unverified toxin and or the undertrained or unlicensed injector. So let's talk
Yes.
first about the unverified and knockoff thing. Something makes money, of course, some criminal wants to come along and capitalize on that. How could I, as a patient, tell if they're
Mhm.
using the appropriate product or if it's the knockoff nonsense?
Yeah, so there's many things that you can look out for, and it will bleed a little bit into like the idea of you want to check out your provider first of all. Are you
Absolutely.
licensed? So we'll assume we do all of that kind of stuff, and I can give pointers on how to do that. But
Yep.
one, first off, if the price is too good to be true, it probably is. So Botox is expensive. Like the cost of getting Botox from the drug companies is expensive. So if you find that's significantly lower than the competition, there could be things going on from a unverified standpoint. But once you're in, first of all, once you're in the actual medical environment getting your treatment, I want everyone to know that they have a right to decline. So sometimes I often will
Love
see
that.
patients that come to me after they've been somewhere else and been like, well, I really like the person. I just didn't feel like I wanted to say no. Or like I've already spent $100 or so as like a initiation fee. I wanted you have the right, and you not only have the right, but you have the responsibility. Just if
Yes.
something feels weird, just say no. So I've talked this on the local news stations here in Los Angeles. My suggestion, and you again have the right to ask for this, and I really enjoy it when people do ask, is please bring me the bottle that you're
Oh,
going to inject me with. Sometimes,
excellent.
and this is not negative for doctors to do this, but sometimes it makes more sense to mix the Botox and bring it into the actual. That's not inherently a problem, but I suggest this patients, if you're new to a practice, just show me the bottle that you're going to use, so you can take a look. Okay, that says Botox or it says Xeomin, and you
Right.
can take it one step further and say, can you please draw up the drug from that bottle? Because theoretically, you could show them the bottle and have something already drawn up.
Yes.
And when you ask them to draw up, you see a lot about their sterile technique, which means how do they cleanse? So you need to use alcohol to cleanse the bottle. Are you cleansing their face? Are they using gloves? All these kind of things that you can see in real time before someone actually injects you. You can just clock, okay, this person is pretty clear about what they're doing from a sterile standpoint.
That's a great idea. And I know some places do it outside the room because people are squeamish about needles. But I think in this era of counterfeit, there, I would rather just see the whole drawing up done in front of me. I think that's a great idea. And it's okay to ask. Thank you for giving patients permission to ask and just say, hey,
Yeah.
I want to feel comfortable and get the best outcome. I would love to see you do that in the room so I can see the bottle. And that's
Well,
okay.
that's entirely okay. So if you go to a restaurant
Yeah.
and you order a fancy bottle of wine or any bottle of wine, that
Yes.
is opened at the actual table. It's decorked for you. You see it. A Botox is probably more expensive than a bottle of wine.
Right?
And I make every effort to do that. I enjoy doing it in front of the patient because it educates them. This is the bottle. This is like the thing. It's almost like we're like sommeliers in a sense,
Oh,
or we should
that's a
be.
brilliant comparison.
Yeah, and because that's people are buying that, so they have a right to have that.
Yes. Oh, I love that. So, and sometimes we do need that permission. Many of us recovering and current people pleasers, they don't want to make the other person uncomfortable. But this is your face. It's an outcome that lasts. It lasts, and it with consequences there can be problems. So let's
Yeah.
talk about now. How do I know who I can trust to inject me? How can I check their credentials and
Mhm.
find out that they are the right person?
So each state has their own level. So you have to
Mhm.
look at your particular state of who can particularly in particular inject these kind of drugs or drugs and practice aesthetic medicine in that regard. In the state of California, registered nurse, physician's assistants can. They have to be supervised by a physician, nurse practitioners as well. But that law may be changing to give nurse practitioners more independence. So if you're there needs to be a distinction between those class of people, registered nurses, and upwards as far as training and
Mhm.
licensure, and then estheticians. So estheticians aren't necessarily nurses, or medical assistants aren't nurses, aren't trained. Those, there might be a handful of states that will allow that. To my knowledge, I don't think so. So that's a first red flag. if anybody that does not have any kind of RN or NP or PA, certainly DO and MD, those people should not be injecting. And you can call ahead to see, what the credentials of who would be injecting. And also, is there a physician on site?
Yep.
Yes
Yeah,
or no?
supervising, does that mean they're actually there and participating and overseeing, or are they not even physically present?
Exactly. That needs to be very, very clear.
Mhm.
And then again, we had a nice discussion about this, but license doesn't not necessarily mean trained.
Yes.
So we have to make that distinction too. So you and I have been through medical school where,
Correct.
we've been, that's the highest level of training in the United States of America from a medical standpoint. And you and I would probably both agree that there was little to none discussion or any lectures on aesthetic medicine.
No, definitely
Um,
not.
and aesthetic medicine is in itself a discipline. And I thankfully within head and neck surgery, there's a lot discussed in residency, but even I was surprised in residency. That's actually part of our curriculum. So that's the part where we say training. So I train with, I'm a professor at Empire Medical Aesthetics. It's a national brand of, there's many others out there that teach practitioners, we teach physicians, we teach nurses how to properly inject. I do a cadaver course where we actually have a cadaver head and we dissect it and we show these are different layers. So that is above and beyond your licensure. So when you ask a particular spa or medical establishment, it would be a great idea to also say what kind of training has this person. They can say, well, I had this certificate or I had this certificate, which is that actually in and of itself is a step above.
Yeah.
And then in light of that, you can also say how long you've been practicing. If someone's been
Yes.
in the industry for 5, 10, 15, 20 years, that is in itself experience and is a good flag, is a green
Yes.
flag.
Yeah. Very green flag. And because you're right, the licensure, you're an MD, I am an MD. What we know in our skills practice are rather different. I practice emergency
Yes.
medicine. I can deliver a baby, set a bone, help with a STEMI type of thing. So the degree is important because then that tells you
Yeah.
at least you've met this standard of understanding of
Yeah.
anatomy, physiology. But really, what have you trained on so you've got that skill set? And I love that you emphasize not
Yeah.
just the red flags, but also the green flags.
Yes. Exactly. And look, aesthetic medicine, I anticipate, I hope that this will be more involved in our curriculum simply because, like, look, I've seen, so Botox is one thing and there's
Yes.
fillers. In my practice, I've had to take care of I hate the word botched, but botched
But
procedures
that's the
where
one we
there's
know. There's the show we see people in real life and on the internet who have just a horrible outcome because they had an idea to change and then they look like a mess. So you see these
yes,
people. Oh goodness.
I do. Yeah, I do. And I'll give you an example. One drug is called Kybella. It's a very popular drug that helps dissolve fat in certain areas. It was FDA approved for the midline, but I've had somebody come in that was injected by someone who was licensed but not properly trained.
Uh-huh.
And then if you inject that off of midline, and certainly in this case it was injected into the cheek, it
Oh,
dissolves fat, but it can
yeah.
also dissolve skin if it's not in the right location, and it can dissolve your nerve if it's not in the
Oh
right
boy.
place. So there's nerve damage, there's destruction of the skin, and that
Wow.
is, I bring that up from an aesthetic medicine standpoint. There needs to be, in general, I would love to have it pushed more into our curriculum in
Yeah.
medicine. But in light of that, you can, every practitioner can get a certificate from multiple institutions to just know the basics of how to inject, what the anatomy is, and what are the side effects that can come from it.
Yeah. So for instance, if somebody looked at your Empire trained people, they can look at what you teach to your practitioners and say, okay, they're expected to meet this level of understanding of nerve anatomy, vessel anatomy, so you don't get an occlusion where the tissue dies.
Yeah,
So then,
yeah,
even if somebody is not interested in being trained, by seeing what their training entails, and then they can say, I would love to go to somebody who has this certificate because
yeah.
I know that I'm going to be more comfortable.
Absolutely. So an issue is we talk about filler. Filler is something that, apart from Botox, filler actually fills in certain areas and can last a
Mhm.
while. There's a trend in social media to do a lot of filler injections in the nose. Again, filler kind of makes the nose, you can contort it in different ways, and there's some great outcomes. What people don't understand, and I teach this, is that the nose, you talked about occlusive crisis. So there's like a bunch of little vessels, and if there's a small space and they get occluded, especially if someone has already had a nose surgery prior, you
Right?
can get necrosis or death of that skin. So we talk about that in my training that we do with Empire, for example. And I would say 90% of the people will say, okay, I didn't know that, not going to do it. And so they just don't involve that in their practice, and nor really should they. And that in itself, the more or more a practitioner knows that, and when you, as a patient, when you go to these places, and if they have that training, you know that you're not going to be injected in ways that can compromise your own health.
Yeah, because I don't want to scare people, because these are safe, these are accessible procedures, it's a lot of things. However, there are dangers. And if it's done improperly, you can have nerve damage, tissue damage, permanent disfiguration if it's not done properly. And this is just your routine injectable. Somebody can go get on their lunch, can lead to these long-term consequences.
Absolutely.
So, well, before we started the recording, we talked about a concept that you and I both really enjoy, and that is aging gracefully. And that means something different to everybody else. So in your individualized approach, there's some very cookie cutter, like everyone gets exactly X unit of Botox, this much filler in their cheeks, whether it suits them or not. So how do you take the fairly like consistent desire across society, ethnicities, gender, to age gracefully with your approach?
Yeah, so you're right. The aesthetic industry is rising, and more people are getting into it. There's a lot of social media influence from people that aren't physicians. My personal approach is, we talked about this earlier, is listening to the patient and what their desires are. And you have to look at people from where they're at age-wise, because that helps inform me what can a face handle. And what I mean by that is, we divide aesthetic.
You can't take someone who's 80 and make them look 20. Like realistically, it's not a thing.
Well, yeah, right off the bat, your bones underneath have changed. So we can even bring the tissue back to where they once were, but your bones underneath have changed. So I always tell people, you can't step in the same river twice. So we can take you back to where those tissues were, but the bone underneath is not the same. So you're gonna look like you had been, or what you're familiar with, but it's just fundamentally gonna be just a little bit different. So yeah, more times than not, people ask me, I want to look natural. So one of the fears is to look unnatural. Some fears are anesthesia, some fears are the recovery, but the number one is, I want to look natural. Now, the word natural is, for me, is tough. And a lot of patients, it's tough to pinpoint that. So what I have found is, people inherently, natural to me, you want to look more familiar to yourself. So for example, your tissues, unfortunately, as we age, they tend to fall with gravity. That's no surprise.
Gravity happens, right?
Gravity happens. Where you look unnatural, especially when we talk about surgery and moving tissues, is that this stuff, or let's talk about your cheeks, falls down here. It doesn't make sense to move it over here. Okay, if you move it over here, that's unnatural. But in reality, it's not familiar. What's familiar is to bring this back up. I used to joke with people, if we were born and all of our tissue was down here, and then all of a sudden gravity was inverted and everything went up, we'd all want it to be back down here. Because that's what's familiar. That's what youth, whatever, in that alternative world, that's what youth would mean. So that's important. So from a surgical standpoint, you need to have the right techniques to make sure that goes back up to where it once was. So we divide aesthetic industry into like surgery, and then we're talking about Botox and filler. So you, as a younger person, Botox is a very wonderful drug, and we can talk about how to use that. Fillers actually have their place, in my opinion, in a very judicial injection technique for those who are younger. For example, lips. When you're younger, I suggest maybe 1 or 2 injections on your lips, because your tissue can actually handle it. But as you get to a certain age, filler actually makes everything fall down, because there's a weight that's involved in it, because this substance actually lasts. So as you age, you need to switch up your techniques, and that oftentimes can involve surgery. And if surgery is done correctly and properly, you don't really know that anything has been done. A lot of my patients do say that, like, what I wanted is just to, like, no one's really commenting on it, but they just say I look younger, or they say I look less tired and I look refreshed. And that's what my aesthetic's going for. And that's what I think of when, if you're going to engage in the aesthetic industry to do some of these changes, like we just talked about, you're born naked and the rest is drag. If you want to do some of these things, do it. To me, aging gracefully is small incremental changes that just make you feel refreshed, make you feel what you do, or you feel on the inside.
Nice. Oh, I love it. So we've talked about Botox, we've talked about fillers. Let's run through options menu style. Because I actually had a colleague once that said that they had gotten Botox and it didn't work. And it did, it froze their muscles, but they just had such deep lines and other skin damage, it didn't correct those. They misunderstood what Botox could or couldn't do. So let's run through what options are. This is fun.
Yeah, so let's start with Botox. And so Botox is FDA approved right here. This is called the glabella. Okay, these muscles here bring your brow down. This muscle bring your brows down. So by turning off these particular muscles, it allows this muscle, this frontalis muscle, to lift things up because it's unopposed. So you get this nice open look. However, if you go into somebody, if you feel like Botox needs to be injected everywhere to get rid of all your wrinkles, that effect can be lost if you just go crazy and inject Botox all over, because you no longer, because this is lifting up, but now you turn that off and you turn these off, so everything is off. And I warn people of that. Some people want that. They just want zero wrinkles.
Like the full frozen look.
Yeah. And oftentimes that's not my style. And people just don't know that there are tips and tricks to make things it's a trade-off. So if you want your eyes more lifted and more open, you do it in specific areas and you don't do it up here. And you might have to live with a little bit of wrinkles because, look, we age. That's just who we are. So that's a good example. And there's other areas you can place it to have nice results. Filler is another option, especially for younger individuals. Some people want it in their lips and some people lightly want it in their cheeks. And the companies say that this stuff will stay inside your body for about 2 years or maybe a little bit less. It's hyaluronic acid, means it attracts water. It's a natural substance that's an analog. So it's a natural substance but made in a laboratory that attracts water to your face and causes a little bit of plumpness. The issue is they've had recent studies that show CT scans that were gated for different wavelengths. You can actually see filler that's still been present for 10 years.
Wow.
And you might think, well, that's great. It lasted a long time. But the issue is, if all you have is a hammer as a practitioner and all you do is inject filler, you will say, oh, well, it's gone away 2 years. You need to have it again. And so you layer and layer and layer this filler on your face. And what it's doing is it's tracting water. And we're seeing this a lot, especially in social media. And people are more puffy and they're wondering why they're so puffy. When they're like, and they think it should have gone away, and they think that it does go away, but it actually doesn't. So we're actually seeing a trend to dissolve that filler. It's not that difficult to dissolve the filler, but if you think about it, and this has not had a lot of studies on this, if you're constantly changing your facial shape, your skin can lose elasticity. It's a lot like these fat loss supplements, which are great. If you lose too much too fast, you get not only loss of fat, but you can get loss of skin tone and muscle.
Ozempic faces all over the media.
So be judicious with filler. As we get older, maybe in your 60s or 70s, do not put it in this area because it just can cause a kind of a pull down effect or a heaviness. But don't be afraid of them either. So it's important. Hyaluronic acid is the actual filler that's the most.
And that's the stuff that already exists under our tissue. So it's not. This isn't a completely foreign substance. We already have it. We're just adding more, right?
Exactly. And you and I talked a little bit about some of the stuff even you have seen of weird stuff that people have injected into their bodies and their face. And
public service announcement. If you are in someone's basement and paying cash for an injection, please don't. Please stop.
If it's motor oil that you're injecting into your behind, that's probably a problem.
Medical, like motor oil grade silicone is not to be injected into humans.
Yes. But it wasn't so long ago, like a decade ago, where there was silicone being injected in people, and I still see it, and people,
Yeah.
and I don't see it being injected now, but I see people coming into my office with residual silicone
Mm.
injection,
Hmm.
and there's not a good fix. So that's why the hyaluronic acid that's being used now, it's the most common filler. So I don't think
Yeah.
people need to hunt too hard for that kind of stuff because it's ubiquitous, but you can actually dissolve it. But you can't dissolve silicone, and there's certain other
Yes.
ones you can't dissolve.
So if something goes
Stick to
wrong
hyaluronic
or
acid.
if you hate it,
Yeah.
you've got a way out of it, which is nice.
Yes.
Yes. Oh,
Yes.
I love that. Okay. So that fix, so Botox for the movement wrinkles,
Yep.
filler to kind of replump those spaces as they used to be.
Yep.
And of course, a good practitioner will put it in the right place for your features and for your age. What
Yeah.
about if I have some skin texture issues, some skin
Yep.
laxity issues? Tell
Good.
me about that.
So yeah, that's the whole category of skin resurfacing.
Uh,
So our skin itself loses collagen over time. It loses elastin. Elastin
mhm.
helps you make things nice and taut. So skin resurfacing is introduced as ways to cause micro controlled trauma in the skin and then allow our skin to heal those micro traumas and make our skin more plump because it's bringing more of our innate, our natural cells that used it to recover. So lasers are the probably the most common skin
Mhm.
resurfacing technique. And then there are so many different brands, but
Right.
as physicians, we think about wavelengths of light, which is a little bit more dorky, I guess, or more
We can
nerdy.
nerd out about
And
this. Yeah.
so there's a wide range, but CO2 laser is the one that I have in my office. It's more of a surgeon's laser because it really is strong. It causes micro trauma to the areas and will help fine lines, wrinkles, textural changes, sun damage, things like that.
Mm, mhm.
What you have to watch out for with lasers as for patients is that if you have a darker skin tone, meaning you have more melanin in your skin,
Yep.
that melanin can be uncontrolled when you have a laser, for example, and people can look darker, people can look lighter after a particular treatment. There's
Okay.
ways you can do to stabilize that melanin with creams prior to, but that's why there's also the invention of what's called radio frequency microneedling,
Mm,
which branded as Morpheus 8. There's some other types of brands out there, very popular. And that has microneedles that go into your skin. So not necessarily old school microneedles that you know, but then it passes a current between those to again cause this micro trauma in your skin. That is tend to be a lot more safe for those who have darker skin tones. However, it
yes.
takes a lot of treatments to get the similar results.
Okay. Yeah, and that's something also that an experienced practitioner would know whether you are less melanated or more melanated. It matters in terms of because you
Yes.
don't want someone to have spots or changes to who they are. You're just trying
Yeah.
to make the skin surface nicer.
Yeah. And a quick fun thing for your patients is if you go out in the sun,
Hmm.
in like probably when you were younger and you didn't wear sunscreen, which we all should, can you burn?
Oh boy.
And sometimes,
Me, three
yep,
minutes. I
oh,
can go get
that's
the mail and I am coming right back with a burn. So
and they say yes, and I say great, and they're like, "You like that I burn?" I'm like, yes. So if you can burn, that means from a laser standpoint, your skin is safe. You don't have a ton of melanin. Unfortunately, you're not protected as a human being, but from a surfacing standpoint, you can. But if you don't burn at all, then I say, okay, let's talk about some creams we can do to stop your melanin kind of overproduction, or we may need to shift you into radio frequency microneedling. But that decision is important to know. But
yeah.
it doesn't matter what skin tone you have, there is something for you from a skin resurfacing standpoint.
That is awesome. There's such a wide variety of
Yes.
options based on your goals, age, level of melanin. I love that. I love the customization of this. All
Yes,
right.
absolutely. And so all those things are more on the, I would say, a little more non-invasive,
Right.
although they can be, but that's not non-surgical. So,
Right. Okay. So let's talk surgery. Say things are
yes.
bagging and sagging or drooping, and we don't want it to. What are the
Yeah.
options?
So the history of surgery, and especially in plastic surgery, is the dreaded F word, which is the facelift. But the techniques have really changed, and there are some pitfalls. Some of the earlier lifts and are still unfortunately practiced today is what we talked about a little bit, is that our tissues were once up here, now they're down
Mhm.
here. It doesn't make sense to then move things over here. Yeah,
Yeah.
so that's the dreaded pulled look. That's the windswept look. But
Like
that's
somebody's
all
coming
about,
behind you with like a ponytail style, but pulling your face. For those
yes,
people who are listening on the podcast, envision that very fake pulled back look.
absolutely. So that is a technique issue. So if you're only able to go to right here from a technique and pull here, you're going to get that look. The issue is if you're not trained, so for example, a facial plastic surgeon is well trained in this, or someone with
Yes.
experience as a plastic surgeon, you have the ability to go here, not under the skin. We're trying to preserve the skin, but under the structural elements of the face. And then I have control to lift things up and put them back to where they once were. That's called,
Nice.
from a medical standpoint, that's called a deep plane facelift. So you're
Okay.
able to go to this structural layer and then lift up. And I ask people oftentimes, and this has got a little bit of a tangent, but how do you like to present yourself to the world? That's part of my
Mm.
interview question, because they'll say, oh, I exude kindness, or I want to be friendly with people. And some people will say, vavoom, I want to walk into a room and want people to know. So
Yeah.
that question I write down, and I have control over how much I lift based on how they want to project themselves to the world. But in this particular technique, it's a foolproof method because it's just lifting things back up. You're going to look like yourself, your more familiar
Yes.
self. But again, you can't step in the same river twice. The bone structure is a little bit different, but it's just you, just a little bit more refreshed. As if you pull from more from the side, then things can drop and you get a thing called the J deformity, where there's like a windswept look.
Yeah.
So there, even within surgery, there is important distinctions on
Mm.
what type of surgery.
Okay. Oh, that's interesting. And so by having somebody who specializes in the face, because you see surgical centers, they're like, great, the same surgeon will do your breast augmentation, tummy tuck, butt, eyelids, nose,
Yes.
face. I like the idea of somebody who's been specifically trained because the face is very complicated. There's a lot of important structures in here. So if
Yeah.
somebody is willing to let someone put them under anesthesia and surgically change their face, what would you recommend for our patients to look for so they stay safe?
That's a good question. So I mean, you're an emergency physician.
Yep.
You had a lot of training in that specific field. You wouldn't necessarily do a cancer resection, for example,
Right.
because that's just not within your purview, and it's just that
Absolutely.
we've devoted your life towards. And likewise, for me, I wouldn't know how to do any breast augmentation or a tummy tuck. I've been trained as a facial plastic surgeon, so that particular field is getting a lot more notoriety. You come through the ear, nose, and throat tract because I'm in the face on so many different levels for all of my training for cancers that were deep down in the bone. So I know every single structure. Gwyneth Paltrow with Goop put out something at least 2 or 3 years ago that makes a distinction like, hey, this is a facial plastic surgeon, and this is a plastic surgeon or more of a body surgeon. Now, there are plastic surgeons that get fellowships in facial plastic surgery. So I think my recommendation would be someone is fellowship trained in facial plastic surgery. If they have an ENT background or ear, nose, and throat background, or if they just had that fellowship, that is somebody who eats and breathes that particular
Mm.
area. You can also ask your surgeon, how often do you perform this particular surgery?
Yes.
And if someone has been doing this for multiple years and week in, week out, then there is your answer. The body is so complex. So if I'm an expert in the stomach, how can I also at the same time become an expert in the face? It's just we only have so much light of time on this earth
Yes.
to focus
Yeah.
and develop and to push the boundaries of what we can achieve. So just those are, but I think our patients don't even know that exists. So we're here to
Yes.
let everyone know there are people called facial plastic surgeons, even with noses. So I do a decent amount of noses, but if somebody is very specific on reconstructing somebody's nose, go to that person, because even
Right.
within the face, there is more nuance.
Yes. Look for the specialty. And above anything else, in addition to training, it's just the number of times you do that thing, because every person is going to be different. You get that experience, how to troubleshoot, how to address problems. And
Yeah.
so what I love here is the permission again to ask What kind of training do you do and how often? This is part of our due diligence. You do
Yes.
not have to give someone money just because you're sitting in their office. Stop with the people pleasing. This is your money. This is your
Yeah.
face. Ask the questions. And if I feel like it would be very red flaggy if you were just like, hey, it's just part of my routine questions. Tell me about your training and how often you do this. I mean, what do you, if they're defensive or
Yeah,
cagey or
that's a
hiding
good.
it?
That's a perfect. Yeah, that's a perfect. So you have a right to ask all these things, and you
Yeah.
should ask all these things. If someone is defensive, that's the second part of this. As a physician, you know this all too well. It's interventions, yes, but then there is follow-up care. There is a thing called bedside manner. There's a thing called we are sticking with you through thick and thin in your recovery journey. So if someone is defensive or if there's not a
Mm,
jive between you and the surgeon, yes, that person can be very, very good. But if there's not this relationship that's developing between you two and you feel comfortable, chances are after your surgery, if everything goes well, wonderful, awesome. But if things as surgery just is, if things don't go as expected, because there are risks to all of
it
us,
can happen
you
with the best
you need
surgeons. Yes.
you need somebody who has your back, who's
Yes.
there for you, and who's going to walk you through this all the time. And how do you judge that? You can look at their reviews. That's important to see if you have a lot of reviews and people are very happy with them. But also, it's a very intimate relationship. So if you're at the best surgeon from a technique standpoint, you're confident that, great. But if you don't have a connection, beware. I know there's many practices that will do surgery and then put up a gate that you can't necessarily see the surgeon
I,
afterwards.
I've been ER for 18 years. I see those patients in the ER because they don't have anywhere else to go. They're like, hey, this is swelling, this is bleeding, this looks infected. I'm calling my surgeon. They're not answering. They're not helping
Yeah.
me. And so that was my frustration with the industry because I know there are great practitioners, that these are
Yeah.
great modalities for people who want to age gracefully.
Yes.
And you've really helped frame this so
Yes.
that people understand. So, I mean, you and I could nerd out all day. I know, I already know that
We
that.
could.
So I'm already picturing the second episode with you, the follow up, so we can
Great.
dive deeper into some of these. We'll look for the questions and we'll dive deeper into some of these techniques. But to wrap up this discussion, what else, what other kind of messages would you like patients to know as a closing message if they are interested in aging gracefully?
So I think a lot of what we talked about, this industry in general is there are regulations, there are great physicians, there's great nurse practitioners and registered nurses. Just please, by listening to this podcast, by looking at reputable individuals and their advice, do your due diligence. I think one of the biggest takeaways is if it doesn't feel right, just don't do it. When people come into this office, it's meant to be a happy experience. People are
Yes.
coming here because they're actually healthy. And you see a different segment of people. People are actually unhealthy when they come
Yes.
in. And so if you are healthy and you come in, this should be a pleasant experience, both with the physician, but also if you're feeling unsure about things, then don't do it. Because look, I think of things as risk versus reward. So if the risk, which
Mhm.
always exists, if the reward or your motivation to do this does not match or exceed that risk, just don't do it. It's all okay. So that's one of my biggest takeaways is know your provider and know your responsibilities and rights as a patient. And you're not going to step on anybody's toes. I know the nicest people tend to be people pleasers, including myself, but just you have a right. Yep.
Yes.
That's my biggest point.
Oh, I love that. I love that. So, if anybody and I love on your website too, which is davisfacialplastics.com. We'll put this all in the show notes, including your Instagram. What I love about your Instagram is that you use it to educate people, to teach, to show what's possible. It's not just a bunch of things like, oh, look like a movie star, but it's here's how you can actually look and be and feel your best in the safest possible way. You do see
Thank you.
patients locally. For those of us who don't live in Beverly Hills, you also actually get a good amount of traffic from out of state because people are looking for your level of training, your skills.
Yeah.
So anybody who is interested in a surgeon who is not only empathetic, extensively trained and skilled, also a quarterback, also a Peace Corps volunteer. Those are the people we want to see. I'm going to send you to davisfacialplastics.com or find you on Instagram. It's at Patrick K. Davis, right? Yes.
It is.
That's the thing when your name isn't super extraordinary and out of the
Exactly.
usual. You've got to get that distinction. So thank you so much for being here. I'm already ready to have another conversation.
Yes. I would love that. This is a one great questions. I really appreciate it. Thank you so much.
Awesome. Thank you. Thank you for tuning into Navigating H.O.P.E with me, Dr. Jamie H.O.P.E. It has been an honor to navigate the realms of health and wellness with you today. Remember, in the journey toward a healthier life, knowledge is your compass. If you enjoyed our time together, please share, like, and subscribe to Navigating H.O.P.E. Join us next week where we'll continue to empower your health journey, arming you with the wisdom to navigate life's challenges and keep the emergency room in your rearview mirror.